Good morning, everyone. Thank you for coming here and spending some time with us. My name is Chen, and I am the CEO and co-founder of HEARTio. Every minute, someone has a heart attack. The real shocker is almost all of them are preventable. Our AI can predict heart attacks months in advance. So let me tell you a story. When my grandfather was 45 years old, he had a pain in his chest. He went to the ER complaining of chest pain. They thought that he was having a heart attack. They gave him blood thinners, and what they realized soon after was he actually had a stomach ulcer that presented as chest pain. That decision cost him his life. Now, I will never be able to ask him if he's proud of me, but one thing I can do is create something in his honor. So this company has two main missions. One, demystify the cause of chest pain. And two, create a world where we don't have to accept losing people too soon. So what's our secret sauce? We apply artificial intelligence to the most commonly available cardiovascular test, the electrocardiogram. Our AI has been trained over 14 million data points, and we use it to predict cardiac blockages. This happens in as fast as sending a text. It's 90% accurate, and doesn't require radiation, incisions, catheters, or dyes. So which would you rather have? Our test, which is a combination of a non-invasive signal with our AI, or what's known as an invasive coronary angiogram. This requires a catheter being fed through your wrist or your thigh, shooting radioactive dye into your heart, and then assessing the blockages within the heart with x-rays that might have background radiation of 30 plus years. We allow the physician to assess the level of coronary disease just with a non-invasive signal within 30 seconds. So how close is this getting to market? We've done many of the milestones necessary to get this product to market, including regulatory reimbursement analysis, product development, customer acquisition, and we have 3 steps before we can start selling this product to our existing customers and clinical partners. One is the FDA study, the pivotal study, which I will talk about a little bit later. The second is our 510(k) submission, and the third is obviously launching initial sales. So how close is this to getting through the FDA? The FDA has already approved of this process. We've negotiated with them 3 studies in order to get this to market. We've completed 2 of them with sample sizes of 1,600 and 16,000 patients. And they've already approved the 3rd pivotal study, which is around 670. As you can see here, we have targets from the FDA that they've accepted of 70% sensitivity and 55% specificity, which we've already overcome in the first 2 studies. So overall, the FDA process is largely completed. The last study is relatively de-risked. And after this study is complete, we'll submit to the FDA and will be the first product to assess anatomic coronary disease from any ECG. And so let me tell you about our competitors and why we're not too worried about them. There's a category of companies that use CT scans and analyze them through fluid dynamics or AI models like HEARTflow and Clearly. They actually think of us more as collaborators than competitors. They actually want to work with us in order to increase their own revenue. They have long turnaround times and can't be used with all CT machines, but they feel like we can actually drive more people to them. Companies like Humana and Powerful Medical are also ECG platforms, but they're not focused on coronary disease, and they can't be used with every single ECG device. And then Corvista and Genesis actually require proprietary hardware in order to be used. And so they are oftentimes non-starters, especially with the level of performance that they have. Another way to look at the data that we showed previously is in a BCG matrix, where we have the 2 major axes of accuracy and speed, and we can take a look at what we like to call our worry radius. So companies like HEARTflow and Clearly are accurate but not fast, and then, like I said, they want to collaborate with us, they're not competitive with us. And then Humana is the closest in the top right quadrant. So how do we stop our competitors from eating our lunch? We have FDA breakthrough designation that gives us a lower bar entry and an increased bar for anyone that comes after us. We have an AI that's been trained on over 14 million signals. We have 10 years of patient outcome data. We have proprietary models that will remain a trade secret. And then we have exclusive partnerships that gives us market access and data. And not only that, we have 3 patents. 2 have been issued involving the capabilities, visualizations, inputs and outputs of our technology, and 1 that is pending. So how do you know we're not going to experiment with your money? We've done a thorough market analysis, looking at all available places that this can be used. We've located 2 of them as our primary beachheads, 1 being the emergency department, and the second being cardiology and private practices. And is this market large enough and exciting enough for investors? The answer is yes. Globally, we're looking at a TAM of $23 billion. Looking at accessible ERs and outpatient cardiology clinics, that becomes $3 billion in the US. And then our current existing clinical partners comprise a SOM of $300 million. And let me introduce you to Dr. Brown, who is an emergency room physician at Mainline Health. When you call him and ask him his thoughts on HEARTio, this is what he'll say. Amid hospital overcrowding, rising costs, and prolonged workups, HEARTio gives ED physicians a non-invasive window into coronary artery health. It accelerates accurate detection of acute coronary syndromes, helping identify patients who truly need emergent care and those who don't. Transforming chest pain evaluation and ensuring critical resources are used where they're needed most. And let me introduce a real-life cardiology practice that is very excited about using this technology day 1. The Cardiology Consultants of Philadelphia are the largest private practice of cardiologists in the US. We have a signed LOI with them, and we're in active contract negotiations for them to be our first customer. Their CEO and partners have all invested, and they also have strong private insurance relationships as well. And let's look at exactly how CCP and us would make money through this arrangement. CCP does over 260,000 electrocardiograms a year. Right now, there exists a CPT Category 3 code that reimburses at $130 per read. Overall, this is $34 million of new reimbursement. We would split this reimbursement with us getting $20 million in annual revenue at scale, and CCP getting $14 million at scale. And this is growing fast enough for investors, and that answer is also yes. After FDA clearance in late 2026, we're expecting $5 million in revenue that first year in the market, going up to $170 million by 2031. Now, I do want to put this in perspective. A company that we've already spoken about here, HeartFlow, recently IPO'd at around a $3 billion valuation with around $130 million of annual revenue. And based on their indications and our indications, our total addressable market is much, much larger. So who would purchase this and why? We're at active conversations with companies like Philips and GE Healthcare. They have their own ECG management platforms, and they actually think that we're a great add-on to that existing software base that they have. We would allow their existing customer base to use our software and immediately penetrating the market. And so we're starting with coronary disease, but that's not where we end. We're not a one-trick pony. Every single one of these different products has either been trained or in the process of training, or data has been recently become available in the case of rare arrhythmias. Each one of these products is an incremental market and an incremental revenue stream that is coming after our first product. And let me tell you why I'm so excited to work with this team each and every day. John Moran and Jake Fisher on the right are hospital executives and sales executives that know how to sell new products into hospitals. Dr. Kowaleski is respected and trusted by her peers. Michael Leisure is always driving our clinical programs to success, and Dr. Butchie is always de-risking our FDA path. John Morris has been a mentor to me for the past 7 years, making sure that I understand our obligation to return dividends and profits to investors. He's had his own share of 9-figure exits in the past, but he truly believes that this will be its biggest yet. And I earned my stripes at Google AI. I'm motivated by personal loss, and I want to create a world where no one has to say goodbye too soon. So what are we going to do with your money? Right now we're raising a $2 million tranche that is over 75% committed. This is on a safe evaluation cap of $20 million and a 20% discount. Later this year or early next, we'll raise a $3 million tranche with sales starting in 2027. And like Rob mentioned, we do have our future financing secured. Shepherd Ventures has signed a contingent Series A term sheet with us based on milestones of FDA clearance and early revenue. So I want to leave you with 3 things. 1, heart attacks happen every minute. 2, almost all of them are preventable. And 3, HEARTio predicts heart attacks months in advance. So let's talk. Let's create a company that not just creates returns, but saves lives in the process. Thank you so much for your time.
We have about 3 minutes for questions, if anyone has a question.
Yes.
I have 3 questions. What do you mean by 90% accuracy?
So 90% accuracy.
Just wait, let me finish. What is the endpoint the FDA is requiring you to meet?
Yep.
And how many patients are required for your trial?
Yep. So by accuracy, we mean, does this patient meet the criteria of obstructive coronary disease as defined by the AHA or ACC, which is 70% lesions in non-left main arteries and then 50% lesions in the left main. The FDA wants us to hit 70% sensitivity, 55% specificity as the bare minimum for clearance, and we only need around 700 patients to make that happen.
They've told you that?
Yes.
1 or 2 more questions. Go ahead.
Yes.
What is your reimbursement strategy? Obviously, AI is a new category for major payers, Medicare, Medicaid, and private insurance. How do you plan to actually be considered for reimbursement?
Right, so there is an existing CPT code right now that just came out in November of 2024 that reimburses at $130 per ECG. Their verbiage is AI analysis of an ECG. That will be a starting point for us. We do have very great reimbursement consultancy that actually thinks that we can charge a higher reimbursement rate over the course of the next 3 to 5 years. And the reason for that is because HeartFlow and clearly companies like that, they actually assess the same level of information, but using a CT scan. So if we're able to get a new CPT code that says, hey, this is the same information that you're normally getting, but from an ECG, that would be between the 130 level that's currently in market and the $1,000 that HeartFlow and clearly get.
Is it primarily related to the acute setting? In other words, is it symptoms related when you say sensitivity and specificity, or just anybody walking to a cardiologist's office?
Anybody walking into a cardiologist's office who ends up getting a coronary angiogram or a CCTA.
No, I'm talking about the EKG. You're basing this on the EKG.
Right.
Somebody walks into my office and gets an EKG without any symptoms.
Correct.
Will I be able to detect any
Yes.
heart disease?
Yes.
Based on?
So we've trained a model that's looked at millions and millions of occurrences of symptomatic patients, asymptomatic patients, and the results of their coronary angiograms and other invasive testing.
I assume you're a physician.
I am.
Yes.
In order your AI to generate the output as you desire, what are the input requirements? Like what type of data you use in order to achieve your output?
So we can use any pre-deployed electrocardiogram. No new hardware purchases required. Use the exact same data that you're already collecting.
Including cardia, the pocket ECGs.
Our initial indication will not be for limited leads, but that is coming next. We actually have a demo that we can do for you downstairs with an Apple Watch.
Because we have to move on.
Okay?
Before I introduce our next speaker, hey, I'll have a chance to meet Utkarsh and the rest of his team down in the library on the next floor down. And you will find as you do that this is an amazing team, which is why Shepherd Ventures is supporting them, because of the quality of the team, above all, even above the technology. And because the team is what's going to survive the next 5-10 years to get to exit. And we believe they will survive and will make good decisions